Good morning, everyone. It's Patricia. I hope you've had a good week. I thought I'd follow up this morning on a small talk about another anxiety condition known as obsessive and compulsive disorder, OCD. Let's break that down into the two parts. Obsessions usually are repetitive thoughts that we have that repeat themselves over and over, and generally they're negative thoughts. A compulsion is the behavior that is attached to that thought. So, a compulsion, you have a thought of fear and you're afraid, and so you go to your door and you check all of the locks. And you do that in a very ritualistic way. You may say something over and over to yourself. You may count backwards or forwards. You may say something that helps to add to that ritual. And that basically is OCD. It can be extremely debilitating, but it is highly treatable, like all of our anxiety conditions are. So, you may recall that back in the 90s, there was really a funny film by Jack Nicholson, and it was called As Good as It Gets. In this film, he plays a very successful author, and that brings to light the idea that, yes, OCD patients can be highly intelligent, very creative, and successful. However, in their personal lives, that's another story. All right, so let's take a look at Jack as he is heading into his favorite restaurant for breakfast. You may recall that as he walks into the restaurant, half of the people get up and leave because he has a history there. And his history is very negative. He insults everyone. He has no filters in his speech. He's inappropriate, can be extremely sarcastic. He's rude. He's abrasive. He's obnoxious. All the things that, turn people off. And he ends up sitting, always has to be in the same booth. And you may recall he brings his own silverware. No matter how many times his waitress tries to tell him that that's not required, that they use a dishwasher, that everything is clean, he doesn't believe any of that. And that's a part of OCD. All right, so here we have Jack, and the outcome of going to his favorite restaurant is that the manager ultimately asks him to leave. So, with OCD, we see a pattern of behavior. We see rituals that are deeply embedded in their behavior and in their lifestyles. So it's very debilitating, very isolative, very lonely, frustrating, and generally a very unhappy individual because he cannot seem to control the thoughts that create the compulsions. So, other forms of OCD include hoarding, people that live with their trash and all of their papers and newspapers and food products and everything all over the place because they feel that they may need it at some point. Again, very fear-based, full of anxiety, and a very unhappy, isolated, and depressing situation for them. So, hoarders also suffer from OCD. Another type is the hypochondriac. This individual has thoughts constantly looping that there's something wrong with his body, that he has a disease or an illness or something's not quite right. And so his compulsion is to pick up the phone and he calls another doctor, another appointments made, another visit to some doctor because he firmly believes that there's something wrong physically. Alrighty, so you get some ideas about what it looks like. People have to wash their hands over and over and over and over again. They feel like there are germs everywhere, germophobics. They feel that it's unsafe out there in the world for them. And these are all very real thoughts for most OCD patients. You may see that in the film, Jack goes to his doctor without an appointment. His doctor won't see him, sends him away, and of course, Jack stands there and says, if you thought I had some control over this, I wouldn't be standing here. And that basically kind of sums it up. All right, so what are some of the treatments? We know we know what the problem is. What are some of the solutions? Of course, seeing your psychiatrist or seeing your healthcare provider is step number one. Getting an accurate diagnosis, telling them what's been going on. I hope you're writing some of this down so that when the same thoughts repeating themselves, you can be aware of them and you can then tell your doctor what's really been going on. Medications, of course, are always usually prescribed, and they are antidepressants, anti-anxiety producing medications, SSRIs, which help with the serotonin levels in the brain. All anxiety, as in all mental health conditions, all reside up here in the brain. And in this particular case, as in many others, there's a chemical imbalance that's involved. So when we pour in those medications, we're asking the brain to bring them up and to balance those thoughts out and those behaviors. All right, so what's number 3? Learning to relax and do relaxation tapes and techniques, to go to a yoga class, to do some deep breathing, to go for a long walk, to hit the gym, to go for a run, to get outside, to do anything that will break up the thoughts that are compulsively looping around and around, to distract yourself, in other words, and also to calm yourself down. All right. Make sure that you're drinking lots of water, that you're getting a lot of sun and fresh air, the usual that I mentioned last week with generalized anxiety. We also know that cognitive behavioral therapy does help. And what is that? That is when we know you have a thought, and it may be a negative thought. It leads to a feeling of anxiety coming up. The anxiety then leads to a behavior, and the behavior always leads to a consequence or an outcome. So with using the techniques of CBT, cognitive behavioral therapy, we try to break up those thoughts and break up the attached behavior. And many, many times, with practice, this can be very, very helpful and can be very successful. So CBT is highly recommended, along with group therapy, group support, and also group psychotherapy, where you work with a therapist with other like-minded individuals who also have the same disorder. So you get to know you're not alone, and what are some of the treatments that are working for other people that maybe you can practice and try. We've also, in the last 5 to 10 years, have learned a lot about desensitizing the triggers that are most problematic for people. So in this case, with a professional, we may take you into that elevator and have you put one step in, or take you to an assimilated airplane and have you sit there for 30 seconds, or take you to someplace high, like a bridge, or the top of a building, and have you just take a deep breath, very slowly, baby steps, where we are trying to have you desensitize and get exposed to that trigger and try to lessen it over time. So we know that also is a treatment that works. During this time of pandemic, most of us are experiencing some anxiety in different forms. Remember, it comes in mild, moderate, and severe. Jack definitely had it in a severe way. You may recall that anytime he got agitated or irritated, he would act on it impulsively with, for example, the small dog. He couldn't stand the small dog barking, so he went out into the foyer, took the dog, and you may recall he threw it down the garbage chute. All right, inappropriate. But that seemed to lower his anxiety. And of course, he didn't make any friends by doing that. All right, so in conclusion, I know I've given you a lot of information. Please share some of this or all of it with a friend, anyone in your family that you know may suffer from anxiety. But know that during this time of the pandemic, we are all asked to be aware that there is a very dangerous, life-threatening virus, and we have to wear our masks when we go outside. We have to wash our hands thoroughly several times a day. We have to make sure our surfaces are as clean as they can be. All the Lysol products are sold out probably at this point. And this is just the tip of the iceberg of what someone who suffers from OCD lives with day in and perhaps a lifetime. So there is this hyper vigilance that goes along with OCD that is exhausting and very isolating. So there is treatment. I hope some of this has been helpful. I'll leave you with a quote, and it goes like this: "You don't have to control your thoughts. You just have to stop letting them control you." All right, I'm Patricia. I hope this has been helpful. I'll see you next week where we'll talk about panic attacks. Have a great week, everybody, and stay safe. Thanks for listening. Bye for now.